Hello, my name is Chelsea Fitzgerald. I'm a program manager with James Care for Life. I'd like to welcome you to our Caregiver series, Tips for Managing Stress. Dr. Elizabeth Monks will be presenting this evening. Liz Monks is relatively new to Ohio and to The Ohio State University, moving to Columbus 7 months ago to pursue her passion working with cancer patients. Liz is currently an assistant professor with the Department of Psychiatry and Behavioral Health and a clinical psychologist with the James Psychosocial Oncology Department. She received her doctoral degree in clinical psychology from St. Louis University and completed her internship at the University of Wisconsin. She completed her postdoctoral fellowship in psycho-oncology at Washington University's School of Medicine's Siteman Cancer Center in St. Louis in 2014. Liz is currently involved in research, teaching, and supervising a health psychology rotation in oncology here at OSU. In addition to working as a clinician full-time, seeing cancer patients, their families, and caregivers to address emotional and psychological needs as they relate to the stressor of coping and dealing with the cancer diagnosis. Although she is a native Wisconsinite and an avid Badger fan, she is slowly but surely becoming a Buckeye fan and taking solace in the fact that she's not from Michigan. Welcome.
Like Chelsea said, I am a cancer psychologist here with the James and an assistant professor with OSU, and I'm going to be talking a little bit tonight about caring for caregivers and talking about some tips for managing stress. So I wanted to start off with just talking about the objectives and the things that I'm going to focus on tonight. First, just defining what a caregiver is, talking a little bit about what stress is, how we assess caregiver burden and stress, discussing some skills for stress reduction, and then reviewing some specific approaches that seem to be helpful in managing stress. And some of those are going to be stress management things that can be applied more broadly, but specifically for caregiver stress. So as we know, anybody who's been a caregiver before, a caregiver has many roles and many hats. So a caregiver works with the healthcare team, has an important role in improving the patient's health and quality of life. Caregivers can really be anyone. Could be a spouse, a partner, a child, a relative, a friend. Could be somebody that you work with in the hospital, a staff member. And roles really may differ depending on, this is obviously specific to cancer patients and their caregivers. And a lot of times those roles differ depending on the stage of survivorship, so where your loved one is in the process. So, if it's early diagnosis, the role might be much more focused on helping the patient learn the medical system or gather information or just sort of navigate this whole new, overwhelming world. If the patient is more in a treatment phase, it might be coordinating appointments, schedules, figuring out insurance, being sort of the in-between person, talking to the medical team, also trying to maintain just life in general, household tasks, finances. Caregivers also provide emotional and spiritual support, help with decision-making, monitor changes in health or just changes in the patient in general. And, I think it's also really important to remember that caregivers are in multiple roles and are juggling all this, which is where I think stress tends to come in when you are caregiving, but also sort of managing. Life doesn't stop when you're a caregiver, so you have to keep juggling all these balls in the air, which can become really stressful really quickly. So there are a few different definitions of stress. I think we all kind of define stress differently. One definition is that stress arises when individuals perceive that they cannot adequately cope with the demands being made on them or with threats to their well-being. Stress is often described as a feeling of being overwhelmed, worried, run down. It can affect pretty much anyone and everyone. No one is immune to stress. And, by definition, stress is any uncomfortable emotional experience accompanied by predictable biochemical, physiological, and behavioral changes. That's kind of a mouthful. When I think about more of the biochemical or physiological response, I think a little bit about, okay, when I'm stressed out, what is my body doing? That's sort of the physiological biochemical process. So, if you've ever been stuck in traffic, you're driving on the highway and the person in front of you slams on their brakes, and then all of a sudden you have to slam on your brakes, and you have this surge of like, oh my goodness, I have to act right now. That's sort of our fight or flight response kicking in, which is a very evolutionarily designed process that kicks in whenever there's a threat or whenever there is danger. So our bodies really amp up to like fight off the threat, stop the threat, or get out, which is why we have fight or flight. The thing we know about stress is that stress activates that same system. So when we are chronically stressed out, whether that's because you're caregiving or whatever, job stress, whatever the case may be, that fight or flight mode is sort of on halfway. And that's a lot of like wear and tear on our bodies, which can make us really run down. I mean, that's why we end up, with headaches when we're stressed out or really tired or just feeling like we're carrying all of this tension in our bodies. Stress can really have an impact on us physiologically. So that's kind of the take-home point of that last blurb there. We tend to talk about stress kind of, I guess, colloquially, that stress is bad. When you hear stress, you think negative, bad things. But not all stress is necessarily bad. So we do need some stress to be able to operate. And we have this model, this Yerkes-Dodson model, that sort of illustrates arousal is on the bottom, which is, you could consider arousal stress, and our performance. So there's this connection between how stressed we are and how well we are doing or how well we are performing. And there's a little bit of a sweet spot, which is where you see this curve at the very top is the sweet spot, where you have just the right amount of stress that makes you perform well. If your stress is too low, your performance isn't going to be great. If your stress is way too high, it's not going to be great. So I think this applies a lot to like athletes, right? So if you are playing in that big OSU football game and you've got 10 seconds to tie the game as the quarterback, you are going to have some stress, but you need some of that stress to be able to perform. That's going to make you focus. It's going to make you pay attention, be motivated. You need that stress. But too much stress may make you fumble the ball, or not enough stress may make you feel like, oh, well, it's not a big deal. It doesn't really matter if we win the game or not. So the ideal amount of stress is important. So this kind of highlights that not all stress is bad. So I think about, somebody coming into an ER, right? Or some natural disaster happens and the ER gets flooded. The staff are going to be stressed out, right? But they probably need a little bit of a surge of stress to get organized, get triage, figure out who needs what, get going, get motivated. Too much stress could cause chaos. Not enough stress is probably not going to get people help, get people motivated. So again, just a couple examples that remind us that not necessarily all stress is bad. We want to have that like sweet spot, basically. If there are questions about that, I'm happy to talk more about that, definitely at the end. I know it can be kind of confusing, but not all stress is bad is the take-home point, but we want to manage it so it's not too high, and we also don't want it too low. So caregiver burden is defined by the extent to which caregivers perceive that caregiving has had an adverse effect on their emotional, social, financial, physical, or spiritual well-being. And this is very individualized. So everybody kind of experiences their stress differently, depends on the person. And it's very multi-dimensional, which means it's complex. So it may be dependent on other things that are going on. Maybe that's job stress in addition, or having multiple caregiving roles. It really depends. It has lots of different dimensions. And we also know that caregiver burden can occur with staff working in hospitals. They could be caring not necessarily only for cancer patients, families, friends, But we see a lot of caregiver burden in the cancer population, and also like stroke and dementia and Alzheimer's, where there's long-term caregiving going on that can become very stressful very quickly. So assessment of caregiver burden. So this is something that I do a lot in my job when I encounter patients and their families and their caregivers, is trying to really hone in on who the caregiver is and ask them a few questions about how they're doing, because I think sometimes it's pretty easy to get very patient focused, and as we should be, but we should also be caregiver focused as well. So, it's important to figure out who the caregivers are, identify them, make sure, I always make sure to ask, like, is there anybody involved in your care who's not present here today? Anybody that we're missing, just so I know who's involved. And making sure that we incorporate the needs and preferences of both the patient and the caregiver in planning. So, a really simple example might be, I might see a patient in therapy and we may be scheduling an appointment. If I don't take into account that the patient's wife is providing the transportation, I'm gonna have a fail here. Like, I need to incorporate the caregiver in my plans because they're an important part of what's happening and an important part of the care. That's just a trivial example, but an important one. It's also, I think, important to make sure that we check in with caregivers' understanding of kind of what their role is, what's expected of them. Do they need anything to carry out their tasks? If you're sending, a patient home with a whole multitude of medications and the caregiver is sort of in charge of making sure that all these medications are given at a certain time and adequately, like, does the caregiver have all the information they need? If they have a question, do they have the number they can call? Really checking in and making sure that they have what they need to do their job. That helps decrease stress a little bit, not a ton, but every little bit counts. And also just recognizing the need that just one check-in isn't enough, that we should be consistently checking in with caregivers and, along the trajectory, just to make sure that they're doing okay, or checking in to see if they need something different or if needs have changed. A lot of times I like to ask, caregivers also, like, when's the last time you saw your doctor? When's the last time, you checked in about taking care of yourself? Because I think caregivers put their health often to the side very quickly, and it's important that caregivers stay healthy themselves. I also like to check in about, like, quality of life. Who are your supports? What are you doing for fun? Which is usually the answer, like, not very much, but, at least it's maybe a little reminder that if you can snag 5 minutes just for yourself, that's an important 5 minutes. So in addition to some of those approaches, it's important to make sure that we are exploring the caregiver's sense of well-being and confidence in their ability to provide care, making sure that, do you need additional support? What do you need to feel like you can do your job well and care for your loved one to the best of your ability? Because caregiving is an important job and a valued one. So there are some different risk factors that are associated with caregiver burden. I think a lot of these probably make a lot of sense as to why they are risk factors. So, for example, being female. I think in our societal roles sort of dictate women as natural caregivers, and so sometimes it seems like it's the case that maybe some of the caregiver burden falls on women more generally. Not to say that men don't suffer from caregiver burden at all, but sometimes gender or sex can be a risk factor. Low educational attainment, residing with the care recipient, which is an interesting one because I think a lot of caregivers are living with the person that they're caring for, but you can see how that's a risk factor. If you're just a friend who stops by, provides meals, cuts the grass, comes over to provide some emotional support, but you get to go home, you get a break. So if you're living with the person, that's sort of a constant stressor, I guess, in some ways. So I think that's probably why that's a risk factor. Depression or any kind of like mental health concerns that are pre-existing obviously can put you at risk. If you're socially isolated, don't have a lot of your own support, financial stress, which that's hard to not come by, it seems like, especially when cancer is part of the picture. High number of hours spent caregiving. and lack of choice in being a caregiver are all some risk factors. Some of the signs of caregiver stress, so when these are maybe some signs that, I feel like probably a lot of people who are caregiving are experiencing these things. But maybe just if some of these things are happening or a lot of these things are happening, it might just be a trigger to reset a little bit and say, okay, I maybe need to find a little time for myself because I am really struggling here. Physical exhaustion. People, I feel like caregivers often say, like, I am just exhausted. Like, I have nothing left to give. I'm just totally depleted, totally drained. A lot of people report guilt, like when I take time for myself, or like I decided to go out for one night with my friends, and the whole time I just felt awful because I felt like I should have been home or should have been doing something else. Starting to feel resentment or feeling like you're getting critical or irritable or short. Feeling trapped, not sleeping, not exercising, sort of putting to the wayside all the things that you would normally be doing. Now, I know that's kind of a double-edged sword because when you're caregiving, time gets really limited really quickly, so you may not have all the time that you want to, do your 7-mile run or, go to the movies every weekend or whatever you do for fun. But when all of that stuff starts to fall to the wayside, that can be a sign of increasing stress. Feeling like you're unappreciated and feeling like your mood's not in a great place or feeling more worried or anxious or just apprehensive, all signs of increasing caregiver stress. So maybe if some of these things, all of these things, a bunch of these things are all happening at once, that can be kind of a red flag that, okay, I need to kind of figure out what I need to do to get some of this stuff evened out, which I'm going to talk about, lots of ways that you can try to do that. So how do we address caregiver stress? What are some of the things that you can do? So some of the basics are, I think we hear and we tell people self-care all the time. Really, what does that mean? How many of us actually take the time to do self-care? I have to practice what I preach, of course, but seeking support, using your supports, that's what they're there for, really honing in on, maybe it's clergy, maybe it's a professional, a neighbor, friends, whoever the case may be. Participate. Know that your role in the medical team is super, super important. So don't be afraid to be an active participant. Absorb as much information as you can. And try to get some respite. Try to get some break somewhere. And I'm going to talk a little bit about that. Can be 2 minutes, that can be a weekend vacation. It doesn't necessarily have to be long or a lot or anything extreme, but just find some way to get a mental, physical break from your duties and allow others to help to allow you to get that break. So some of the stress reduction approaches are, some of them are pretty simple. Some of them are probably things that you're probably already doing. We'll kind of talk them through as we go. But the key is to, and this image, I think, really hones in on do what works. So you all are going to know how you deal with stress best. And so what has worked in the past is what exactly you should be doing currently. So if you know that sitting down and reading a good book is a way you distress, then do that. If you know that meditation or yoga is your thing, get back involved with that. Try to figure out, do you need to manage your time better? Are you missing that were you regularly an exerciser, now all of a sudden you're not? Can you find a way to incorporate that? Get some relaxation, eat a good diet, sort of all these basic things. Kind of take care of yourself more generally. This is just kind of a general, do whatever works for you. One thing that I think is really, really important, as far as we preach all the time, like use your social support, use your supports, is to manage your expectations as far as what you're going to get back from your support, because not everybody is great at providing all kinds of support. So if you think about the people in your life who provide you support, think a little bit about like where these people fit in. So this breaks it down, this graphic breaks it down into 4 types of support. So emotional support, practical support, information support, companionship support. So the emotional support are the people who really can listen, validate your feelings. They're not necessarily trying to jump in, change things, tell you what to do. They're just purely there to be an emotional support, to listen. And some people are really, really great at this. Others aren't so great at emotional support, and maybe they're better with the practical support of things. So those are the people that are bringing you a meal, offering to, take your kids to soccer practice, or helping out with chores, or just really getting in there and doing more of the practical things that you need. Some people are better with the information support, so those are the types that have really good suggestions, they have great advice, maybe they've been through it before, and so they have information to share with you. And then you have that companionship support, just somebody to be with you, to spend time, to do something fun with you. You have to kind of think about, okay, if I'm asking for support, if I really need that emotional support, calling up the practical support person probably isn't going to be so great. So utilize people for what they are experts in, I guess, so to speak. I had a patient the other day tell me that I shared this with her, and she was like, oh, I have a food support. So she has a friend who is a chef, and he does all of the cooking and brings meals like every day, all day. And she's like, this saves my life. Like, I would be lost without my food support. There are all kinds of different supports you can probably think of. Like, I like to think of somebody being like a kind of a normal support, somebody that you can just talk to and talk about everyday things. Like, sometimes it gets to be a lot, always talking about illness or, oh my gosh, all the stressors in life. So having that person that can just kind of shoot the breeze. And occasionally I feel like we have those friends that no matter what's going on, when you call them, they're going to tell you about their problems. And maybe sometimes you need that. Maybe sometimes you just need a distraction, or you need a reminder that you are still a friend too, and you can still provide support to your friends in other ways. You don't want to take on too much or be more burdened, but it's just an example of lots of people can provide lots of different support. So be sure to kind of think about your expectations and what you're asking or expecting from people based on kind of what they're good at. So there are a few different caregiver interventions. I'm going to talk a little bit more in depth about each of these kind of as we go. So cognitive behavioral therapy is a specific therapy approach that we use. It can be in a group setting, in an individual setting, and it can be really great for caregivers and addressing caregiver stress. And I'll talk a little bit more in the upcoming slides about what CBT, we call it CBT for short, cognitive behavioral therapy. Really trying to focus on problem solving, acting, doing versus worrying. Time management and short-term goal setting is really important. I think it can be really easy to get really caught up in kind of chaos and feel like a day has gone by and you don't even know where it went. So setting short-term goals and really managing time is important. Managing technology-related stress. So I feel like nowadays, with us being so attached to our phones and our computers, it gives people access to us, but sometimes too much access, where people are like, what are you doing? How are things going? You're getting emails, you're getting phone calls, you're getting text messages, and it can get really overwhelming really quickly. So, people do the managing technology stress in different ways. I mean, I know there are things like Caring Bridge, which you have maybe a blog, or you use Facebook or whatever to just sort of disperse information all at once, so you don't necessarily have to take all those calls or take all those emails. Having a designated, maybe this should be another type of support, like tech support, having somebody designated to disperse information or be the go-to person. Everybody else can go to that person versus you. I don't know, have days where you just have your phone off, or whatever you need to do to sort of manage that seems like that can be a stressful thing for people. Sort of everybody wants to know what's going on and check in, and that's great, but that can get overwhelming. Effective use of support, which I feel like we talked about, knowing what you need from others, not being afraid to ask for it, but knowing who's good at what and managing those expectations. Things like diaphragmatic breathing and muscle relaxation are just great ways to sort of bring that physiological stress response down. So like I was talking a little bit about earlier, when we're stressed, we tend to carry a lot of tension in our bodies. Our hearts might race. We might have, just a lot of stress physically. And something like diaphragmatic breathing, which is really breathing kind of with your diaphragm. If you could probably find books on it, or if you like Google diaphragmatic breathing, lots of examples and stuff would come up. And doing muscle relaxation, sort of working through your body to like tense muscles and relax them. That really sends, when your body is relaxed, it sends messages to your brain that things are okay, that you can sort of, okay, chill out. If I walk around like, a tense ball all the time, that's sending signals to my brain that things are not okay. So it really is important to find ways to like physiologically relax your body, and diaphragmatic breathing and muscle relaxation are just a couple ways to do that. Good sleep hygiene. Goodness, if we could all sleep, that would be great. It seems like sleep is often the first thing that gets really disrupted when people are stressed out. So good sleep hygiene and a consistent sleep schedule is important, and I'll talk a little bit more about that as well. So for just a second, let's talk about what does not seem to work when it comes to managing caregiver stress. So the idea that you should just be positive, like just try to be more positive, just find, just sunshines and unicorns and rainbows all day, like that just doesn't work because it's not very realistic. And that probably applies to stress just in general, like just telling someone, oh, you just have to be more positive. That may work in the short term, but probably not so great for the long term. Just kind of saying, oh, everything will be fine, don't worry about it. That approach isn't so great either, because when you're caregiving and dealing with stress and dealing with somebody who is ill and sick, there are very real stressors, very real things to be worried about and concerned about. So it's not always feasible to just stop worrying as though that's a really simple thing. Thought stopping. So I've heard people say before, like, I just need to stop thinking about this, and really focusing on like trying to like block all this stuff out, which doesn't seem to work. It's almost like the harder you fight against your thoughts or your feelings, the more they come through, or you may be able to hold them off for a while, but then they sort of trickle in ways that maybe aren't so helpful. So it's not always the best approach to just be like, no, I'm going to block it all out, or I just want to stop whatever I'm feeling or stop whatever I'm thinking, because sometimes then you get pent up, right? Then you're holding all this stuff in, and eventually it has to come out somewhere. And that kind of fits in with avoidance. Using alcohol or drugs or, distractions are great for the short term. I'm definitely a big proponent of, okay, I need to get out and go do something else just to get my mind off of things. Distraction's great for that, but not so great kind of over the long term. Good short term, not so great long term. A lot of times, anti-anxiety medications don't always work so great for managing stress. Now, if anxiety is really a key role, and you've talked to a professional about anxiety symptoms, obviously an anti-anxiety might help. But just general stress, anti-anxiety medications are shown not to be very helpful at just being a stress reducer. And most people who are chronically anxious actually get better with more of the cognitive and behavioral strategies, kind of working on your thinking process or working on your behaviors seems to be actually more helpful than anti-anxiety medications. So let's talk just briefly about cognitive behavioral therapy. I feel like I could probably spend like a whole hour just talking about this because it's kind of a big topic. But this is an evidence-based therapy approach that, and there's lots of like books out there and stuff that you could read. It's something that you could teach yourself sort of the basic tenets of. There's kind of a lot to it, so it probably goes a little bit better if you sort of have a professional sort of guiding you along the way. But I think some of the general tenets of this approach are easy to use and kind of easy to understand. But cognitive behavioral therapy, or CBT, is very structured. It's a brief therapy approach, time limited, so usually about 8 to 12 sessions is how we deliver it. And it's usually very focused on what's happening currently, what the current behavior is, not not necessarily like this happened, a long time ago. It's really focused on the here and the now. And it's been shown to be really helpful in treating anxiety disorders, insomnia, depression, eating disorders, chronic pain. Super helpful approach. So this triangle here is sort of the basic understanding of what CBT is. So the philosophy behind CBT is that our thoughts and our feelings and our behaviors are all connected to each other. So if you want to change how you feel, if you want to change your mood, change your anxiety, you have to intervene at the thought or the behavior level. So the idea is change the thinking, change the behavior, you have an impact on the emotion. So an example might be, standing up here right now, I may start thinking to myself like, oh my goodness, this is streaming live, like all these people out there are listening to me. That's actually making me really nervous. And I might notice my anxiety start to increase. So, okay, I need to change that. So I can either change the thinking process. So that thinking process of like, everybody who's streaming in right now is critiquing what I'm wearing and not listening and thinking, oh, she doesn't know what she's talking about. Okay, so those thoughts aren't very helpful. They're making me feel more anxious. So how can I change the thought? And it's not necessarily that I have to change the thought to be 100% positive, but just change it enough to be realistic, which is I'm doing the best I can. I think people who are streaming in are hopefully learning something and taking something from this, and it's going to be fine. And even if somebody at home isn't paying attention or whatever, it's okay. It's not the end of the world. Or I can change the behavior. So it's kind of hard in the moment, but if I was feeling like my anxiety was really surging right now, I might just need to take a deep breath and sort of get my breathing under control, take a second to reset, and then get back into it. So change my behavior. So I can either change the thinking process or change the behavior and get an impact on how I feel. And that is sort of the basics of CBT. That's a really, really short synopsis, but a lot of times it's important to just stop and think, okay, am I thinking about this realistically, or am I jumping to conclusions? Am I blowing it out of proportion? Am I seeing it in like all or nothing kind of black and white terms? How can I find a balance in my thinking? Or do I need to do something different? Do I need to act differently to have an impact on, on my mood or on my anxiety or on my sleep problems? So that's like tip of the iceberg CBT, but it can be helpful to just occasionally remind yourself to check in on how your thinking is or what you're doing to try to help feel better. So it's also, I think, important when we have a lot of stress in our lives to kind of break it down into whether the problem deserves like sort of a solution-focused approach or an emotion-focused approach. And what it really, I think, breaks down into is whether or not you have an aspect of control. So you can kind of think about, okay, so I have this problem, insert whatever the problem is. I don't know how I'm going to get my significant other to their chemotherapy treatments for the next week, or, whatever the problem is, and ask yourself, like, can I change it? Do I have some aspect of control over this? Is there something I can do about it? If it's yes, then you sort of work your way down to, is now a good time to work on it? Do I have the resources? Do I have the ability to work on this right now, or am I too exhausted or too tired? If it's a good time, then you move to problem-focused coping, which I will talk about in just a second. If it's a problem that you can't change, maybe it's something that's out of your control, like I am super worried about whether or not this treatment is going to be successful. Okay, so I don't really necessarily have, a caregiver may not have control over that. So if you can't change it, you don't have any control, then you need to, there really is no solution, so you have to cope emotionally, cope with the emotions that come along with it. And so the problem-focused coping is very much focused on, I feel like we learn very early on, and I'm going to skip ahead for just 1 second, to just highlight the steps of problem solving, which seem really simple. I think everybody knows like the steps to problem solving, but I think in the moment of stress, you can lose track of this really quickly. So if you're you have a problem and it's something that you can solve and that you can work through these steps. So really define the problem, brainstorm as many solutions. I don't care how crazy the solution is, brainstorm every single solution, ask other people what their solutions might be, weigh all the alternatives, weigh the pros and cons of each solution to help you select the best alternative, and then do it and see how it goes. Monitor the progress. If it's not going well, go back to all those things that you brainstormed, try another one, kind of work through it again as many times as you need to. Looking at this, I'm like, yes, of course, we all know how to do this. This seems really simple. But I think when things are really, really stressful, it's easy to get caught up in like step one, like just getting caught up on what the problem is and never moving forward to like what I can do about it or what I can change, or getting caught up in like I could do this or 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 this or this, and never actually breaking it down into, okay, what am I actually going to choose? So it's important to keep these steps in mind, even though they seem pretty simple. So problem-focused coping, if you have some problem that you actually can have some control over and you can change, use that problem-solving approach, get organized, manage your time, get some support, use assertive communication, whatever you need to do. Basically, if you have a problem, there's something you can do about it, do it, act. If you have a problem, can't change it, nothing you can do about it, out of your control, then it's more a matter of coping with whatever the emotion is. So then you're going to be doing more emotion-focused coping. And that might be short-term things like distracting by, maybe it's going out and taking a walk, or trying to get to, a yoga class or a movie on the weekend, talking with a friend, doing some of those relaxation techniques I talked about. Mindfulness can be an important aspect. I feel like mindfulness is becoming very popular these days. Mindfulness is all about being in the present, being focused on the here and the now. It's really, really easy to get caught up in what's to come, what if this, what if that. Very easy to get caught up in shoulda did that, shoulda done this, oh my goodness. And so we end up missing like what's most important, which is right here, right now. So mindfulness is really important, and breathing is a great way to practice mindfulness, and the reason is because the breath is always happening. So if you take a second to just check in with your breath, follow your breath, count your breaths, you're being mindful because you're paying attention to what's happening in the here and the now. We take something like 10,000 breaths a day, and how many of them are we actually aware of? Probably not very many of them. So when people say breathing, deep breathing, it's really important. Like, it is actually really, really important. Something like deep breathing can bring your stress down. It can help you practice mindfulness. It can be hugely, hugely important. I've seen people like bring their blood pressure down just by taking 30 seconds to do some deep breathing. So it can have a very important impact. And of course, obtaining emotional support in whatever way you need to do that. So we've kind of covered that one. So let's talk just for a few minutes about just some really, really basic ways to improve sleep. Sleep seems like it's something that gets really thrown off very easily and very often. And some really key things are to try to keep a regular sleep schedule. I know that's really a tough thing for most people, but trying to have a bedtime that stays the same and a waking time that stays the same. Even on the weekends. I know a lot of people are like, but I like to stay up late on the weekends and then sleep in. Try to keep it as close to the same time going to bed and getting up as possible. Using your bed only for sleeping and sex. That's the only exception besides sleeping. So no computer I can't say that I practice all these things myself, but if you are a sleep sensitive person, like you feel like you really struggle with your sleep and falling asleep, then do not use your bed for working, reading, watching TV. Your bed should just be a place where you sleep. Get out of bed if you cannot sleep. And the reason is the more time you spend in your bed not sleeping, the more your brain starts to associate your bed with a place where you don't sleep. So if you're not sleeping, get up so that only time in bed is spent sleeping. And the rule is about 15 minutes. So if you've been laying there 15, 20 minutes, get up till you feel tired again, do something mundane, I don't know, read a magazine or a newspaper, and then try to go back to sleep when you feel tired enough. If you still can't fall asleep, get back out of bed and do it all over again. It sounds really annoying and irritating, but it works. Adjust your dietary habits before bed. So if you happen to be a smoker, cut that last cigarette out before you go to sleep, because that can have a huge impact on keeping you awake. Cut out caffeine, obviously. Eating a big, huge meal before you go to bed, probably not a great idea. Your stomach's going to be upset. Do what you need to do from a dietary standpoint to help with sleep. Try to break the worry cycle. I feel like when we put our heads down, that can be a prime time for when the thoughts get going and things get overwhelming pretty quickly. So whatever you need to do to break that worry cycle. Some people, they like to journal or write a few things down before they go to bed, or sometimes I will prescribe a worry hour, which is, it doesn't necessarily have to be an hour. It could be a worry 5 or 10 minutes. Just sit, write down every single thing that you're worried about. It could be anything and everything, and just write it down, get it all out, and you've sort of done your worrying. You've done your due duty, you've worried about it, you've written it down, put it aside. Sometimes just doing something active with what's going on in your brain can actually help quiet it down a little bit. Some people toss that piece of paper, some people burn it, some people hang on to them, and it can actually be kind of telling if you look back on it 6 months later, like, wow, that was all the stuff that I was worrying about, and wow, none of that came to fruition, or some of it did, or I ended up coping with that really well. Like, it's kind of interesting to see the things that you worry about and how that progresses or how that changes. Winding down, having a bedtime routine, whatever that is. Some people take a shower before they go to bed, some people read for a while, watch TV, whatever you need to do to kind of wind down and decrease screen time. So it's really important to have the TV off, have your phone off, nothing bright, telling the brain time to be awake. Cutting all that stuff out when you're trying to go to sleep is important. So this skill is a very specific skill for tolerating a stressful moment. So this is more of a short-term stress management skill. This is not something that's going to solve, all the world's problems or anything like that. But this is more for when you're having that moment of like, oh my gosh, I just cannot go any further. I am just at my wit's end. I'm about to lose it. I can't get through this moment. What do you do? So improve the moment is the name of the skill, and improve stands for, it's an acronym. So each part of the skill is represented by the word improve. So when you're having a stressful moment, try to improve the moment. So the I stands for imagery. So the example I have on here is sometimes people find it helpful to, if they're overwhelmed with their thoughts, to kind of imagine their thoughts on clouds. So imagine like laying on a beach or in the grass or whatever the case may be, a calming place, and just kind of putting your thoughts on clouds and watching them kind of float by. Doing something to bring an image to mind, and sort of remembering that, your thoughts, you can have them. You don't necessarily have to get rid of them, but you can also sort of let them go. And remember that in the background is the sky, and that can be you, that you don't necessarily have to become your thoughts. You don't necessarily have to be completely overwhelmed by your emotions. You can sometimes get a little bit of separation, and sometimes using imagery helps with that. Imagery is also, you can use any kind of imagery, whether that's, pulling to mind an awesome vacation spot you've been in, or maybe if you just imagine yourself like sitting on your back deck with a cup of coffee, because that's the image that brings like calm or relaxation. Whatever that image is, bring it to mind. We know that when you bring those images to mind, we activate the same parts of the brain that are activated when you're actually in that spot. So if you can bring a really vivid image to mind, that can really help bring stress down. The M in improve the moment stands for meaning. So meaning making can be really, really important when we are feeling like we are just doing everything we can and it's not appreciated and it just feels like it's never enough. Finding a silver lining. Is there something about this super stressful, terrible situation that means something, is worth something, and trying to really hone in on that. An example is I had a patient who shared with me that he was diagnosed with cancer, and it really connected him back with his like spiritual and religious beliefs, and he felt like that was hugely meaningful. Now, nobody wants to get cancer to be connected spiritually, but if there is a way that you can find even an ounce of meaning within stress, within a terrible situation, that can be helpful in just taking the sting out of it a little bit, knowing that, okay, this is maybe happening for, not necessarily happening for a reason, but there's something about this process that I can find some meaning in or some purpose. There is a whole therapy actually designed around meaning making. It's called logotherapy. A lot of people are familiar with the book Man's Search for Meaning. It's by Viktor Frankl. It's a psychiatrist that went through the Holocaust and lost his whole family in the Holocaust. So, I mean, just the worst of worst situations. And he felt that he came through that by finding meaning, by meaning making. And this psychiatrist developed a whole like therapy around finding meaning in sort of awful, terrible situations. So if you can find a silver lining, try to find it. So the P in Improve the Moment stands for prayer. The Serenity Prayer is a good one. People really like that prayer a lot. And if you're not religious, not a spiritual person, it doesn't necessarily have to be that kind of prayer. It can be non-traditional prayer, just taking a moment to kind of quiet down, process your thoughts, whatever, meditation, whatever the case may be. Just taking a few minutes for yourself. The R in Improve the Moment is for relaxation. We talked about a lot of different ways that you can do that. Whatever you do to relax, do that. Try to get some time in to do that. Mindfulness is also important. So the O is for doing one thing in the moment, finding a way to practice some mindfulness, practice being present, practice being in the here and now, whether that's with your breathing, whether that's walking from work to your car, paying attention instead of on your walk from work to your car thinking about, what do I have to do when I get home? What am I going to make for dinner? What are the kids going to be doing? What do I have to do tomorrow? What's on my agenda? Just walking to the car and paying attention to what you can see, what you can hear, paying attention to the weather, your footsteps as you go, your breath as you walk, and just finding those few moments to be present and trying to not let your brain get way ahead of you or fall back into stuff that's already happened. Finding ways to be present and be mindful can be hugely helpful and important. And there are always, mindfulness can be a very structured approach. Like there are lots of books, lots of workshops, lots of ways to practice mindfulness through meditation and through all these different techniques. But you can really practice mindfulness anytime, anywhere. It doesn't necessarily have to be, I need to find an hour to sit somewhere and practice mindfulness. It can be 2 minutes, however you want to do that. So the V in Improve the Moment stands for vacation. So this is that whatever you can do to find just a few minutes for yourself. That might be 5 minutes with the bathroom door locked where nobody's talking to you and nobody's finding you. Go to your bedroom, pull the covers up over your head and just take like a time out. It can be a vacation too. Like that's great too. We can't all, I wish we could all just like hop on a plane and go to Hawaii for a week, and I'm sure everybody's stress would be way reduced, but we can't all do that. So if you can do that, great. Get away for a weekend, get away for a day, half day, go to the spa, whatever you need to do, 2 minutes, 5 minutes, a weekend, a week. Find time to get a break from the stress, to get a break from things. It's really, really, really important. And if you can find a time a day or find a way to incorporate it into your routine, that's hugely important. So if you know that, okay, before I go to bed, I have 5 minutes where things are quiet and that's just time for myself, or I know on my way home from work when I'm in the car, like I'm turning my phone off. I'm not listening to the radio. I'm just gonna drive home, clear my mind, and have this few minutes to myself, like whatever you need to do to get a break. And the last letter in improve is E, and that stands for encouragement. So this is just a reminder that sometimes we need to be kind of our own cheerleaders and encourage ourselves and remind ourselves that as caregivers, what we do is really, really important. I think social support and caregiving is a challenging role, but a valued role and something that is so important. So know that what you do matters and counts and is incredibly important. So give yourself a pat on the back once in a while, more than a pat on the back. Like you should have a medal, gold medal or something. So improve the moment, just some general things you can do when you're stressed out and you need to just get it together for just a few minutes. These things can be helpful. So the last thing before taking questions that anybody has these are just some resources as far as finding treatment or looking into some of these things that we've talked about today. So if you are looking for some additional support from like a counselor or something like that, EAP or employee assistance programs are great for that. The Ohio Psychological Association has a bunch of information as far as mha.ohio.gov, which has all the community mental health centers. So these are a few websites where you can pretty readily find a counselor, a psychologist, a psychiatrist, if you're looking for some additional support. The therapists at psychologytoday.com goes as far as like what type of insurance people take, what kind of hours they have, what kind of specialty areas different counselors have. So I really like that website a lot because you can really get a lot of details. So those are just some options for finding folks who could be helpful. Obviously here at the James, we have James Care for Life, which puts on tons of programming and so many great things that are happening with the James. You know, they put out their quarterly brochure. You can access the information online. The YMCA and a lot of local health centers often have classes in relaxation or mindfulness or meditation. So keep your eyes open. There are a lot of things that are going on in the community that I think sometimes we miss, or things that are going on here that just get missed, but there is stuff out there. And then the last link is to an online stress management workshop that you can kind of do and work from home. And also I talk a lot about Immerman Angels, which is a national like peer support program. So what they do is they connect caregivers to other caregivers, or cancer patients to other cancer patients with a similar diagnosis, similar background, to pair up people so they can support one another. So you can either sign up to be a mentor or to be a supporter, or you can sign up to get support, and it's, one-to-one, and it could be someone that's like anywhere in the country. So a lot of it is like phone, email, Skype type of support. You're not necessarily going to get someone who's like down the street that you can go to coffee with, but they actually do a really good job of matching you up with somebody who has been through something similar. So they'll have a pretty good understanding of what you're going through, and you'll be able to at least connect on some level and gain some support. Or if you feel like you've gone through this process and you have a lot to offer, which a lot of caregivers do, don't hesitate to sign up to be a mentor yourself. Like, you guys have great information and a wealth of knowledge, and you could be so supportive for somebody else. So sometimes it feels nice to do something nice for somebody else as well. So that's another option.